Hello and welcome to Awaz-The Voice interviews. I'm your host Nazir Ganai. Today we are in the old Secretariat building in Srinagar. Today we are joined by a very special guest, an additional director of Ayushman Bharat, someone who held many positions in the past. He was the medical superintendent of government GB Pant Hospital, Children's Hospital, where his work has been instrumental, and also he held one more position, Commissioner, Srinagar Municipal Corporation, Dr. Shafkat Khan. Dr. Shafkat Khan, thank you so much for joining us. It's been an honor. We will be talking about Ayushman Bharat, the kind of initiatives you have been taken, and tell us something about the whole process Ayushman Bharat has so far been doing in Srinagar.
You know, I understand that Ayushman Bharat is a flagship scheme of the Government of India. It was Ayushman Bharat digital mission was launched in the year 2022, and it was basically meant to be a part of the Digital One India movement, which the Honorable Prime Minister had initiated and dreamt of. And as a part of it, we had a vision to we envisaged to have this entire digital health infrastructure in the entire country, where a repository of health records would be created of the patients, paperless, queueless, seamless, integrated healthcare across the government and the private sector. So, government of J&K was very keen to ease the sufferings of the patient right from his entry to the hospital to his exit via the OPD, the casualty or the IPD services. Healthcare, as you know, has been a high priority of the government over the past 4 to 5 years, and we have magnified, our presence everywhere. And those numbers, the numbers which we are talking about, the indicators of health, we are just within the best 10 right now.
So talking about going, paperless, going, having the best of the services in the healthcare system, Jammu and Kashmir has a legacy of providing and producing some of the finest doctors. Our public healthcare system is at least up to the mark. You have a lot of good men and machinery in your hospitals. Now Ayushman Bharat's intervention has come as a great relief. How are you going to relate all these hospitals in periphery or in tertiary care or in this level?
There will be a repository of basically hospital facility facility registry, the HFR, where we'll map all the health institutions in the government, private sector, and the entire ecosystem will contain the laboratories, the diagnostic centers, and wherever in the peripheral healthcare we have any health institution which caters to the patient, the citizen. It will be a mapping of the health registry and the hospital professionals as well. So we'll have verified health professionals working in verified hospitals and private diagnostic, maybe centers or MRI centers or laboratories or single doctor clinics as well. So we will have, number one, an accountable healthcare system, and we will have verified health professionals working for you. Having said that, you will have to understand what great change the great scheme Ayushman Bharat PMJY, Prime Minister's Jan Arogya Yojana, has brought into our healthcare. It has been like a dream come true for a normal Indian, who would spend all his spending, his economics will go topsy-turvy once he would enter a hospital. It would be an economic debt on his family. But PMJY has, broken all those shackles and become a savior for the poor man, as well as the average Indian. Now with the universal healthcare scheme, which has been introduced especially for the state of UT of J&K by the Honorable Prime Minister, every citizen is covered, every family is covered with 5 lakhs of insurance.
Under SAT scheme.
Absolutely. And now, adding on the digital mission to that, we understand that it will be a digital platform where digitally we will correct our gaps and those areas which were gray in the delivery. And the digital environment, as you have seen, right, in the banking system or other, hospitality industry, food industry, everywhere, it has brought a lot of transparency and accountability to people.
Dr. Saab, since you also spoke about how Jammu and Kashmir government is creating a health ecosystem on the ground, by bringing in all the stakeholders, whether it's a doctor, it's a healthcare professional, or for that matter a patient living in a border district. Now, چونکہ وہ دوست جو ہمیں دیکھ رہے ہوں گے, وہ ناظرین دیکھ رہے ہوں گے, جن کو پتہ نہیں ہوگا کہ آبھا کارڈ کیا ہے. آپ نے you had mentioned that this is going to be a great intervention in the healthcare system. What is this آبھا کارڈ؟ آپ ان کو سمجھائیں کہ آبھا کارڈ ہے کیا اور اس سے کیا فائدے ہو سکتے ہیں.
آبھا ایک یونیک آئی ڈی ہے ایک انسان کی, سٹیزن کی, ہماری کنٹری میں, جو ایک یونیک آئی ڈی رہے گی اس کی ہیلتھ کیئر کی ریپوزیٹری کی. It will be like you operate a bank account and it is governed by the UPI, and wherever you make a transaction, it will reflect on your bank account. That is how, if you for example have a patient entering a healthcare system in the government sector, and he is flashing his account number, the Abha account, his entire medical records are getting onto a vertical in that system. That account, if he goes to a private diagnostic center right from Kashmir to Kanyakumari, or any part in the rural of our country, his health records are going to get logged into this vertical health Abha account. And it is the beauty of the Abha account is that it is a consent based account, where you will with your own consent share the entire health records of the patient.
You also spoke about کہ آبھا کارڈ کے بعد یا جو یہ ڈیجیٹل آپ کا ہوگا, you will also get health incentives. The institution will get health incentives. The patient will get health incentives.
The best part is that to have maximum participation of the people, the Government of India at the National Health Authority level have decided that let's incentivize this to the people. We will incentivize the government as well as the private sector. Wherever they have a digital signature, they will increase and have an account where they will pay money to that institution. And a lot of our government hospitals right now in J&K have already received incentives under that scheme.
تو ڈاکٹر صاحب, اگر ہم کلاسیفائی کریں, آپ کا ٹیرشری کیئر ہے, آپ کا پھر پرائمری لیول پہ ہیلتھ کیئر سسٹم ہے, تو ان کو آپ نے کیسے لنک کیا ہے؟ How are you going to link it?
See, I told you the hospital facility registry, the health facility registry, the HFR, links it on the Ayushman Bharat ecosystem. The building block of the Ayushman Bharat digital mission contains, number one, the citizen with an ABHA ID, the hospital, under the health facility registry, the health professional registry, the healthcare professionals who are working, they all will get logged. So this ecosystem, this sandbox will contain the entire healthcare apparatus, be it in government or be it will be mapped, under this environment. So once you talk about then accountability, mapping, getting the patient onto log to this system, it will have an entire, ecosystem where this entire thing will happen.
ہم نے ریسنٹلی دیکھا کہ کچھ انفیکٹ گورنمنٹ آئیڈینٹیفائڈ دیم, کچھ فیک ڈاکٹرز جو ہے ہاسپٹلز میں گھوم رہے ہیں, انفیکٹ ٹریٹ بھی کر رہے ہیں. ناؤ دیٹ آیوشمان بھارت ہیز ٹیکن دس ویری سیریسلی اینڈ یو آر گوئنگ ٹو ویریفائی دیم انڈر دس ہیلتھ رجسٹری. واٹ از دیٹ ہیلتھ رجسٹری اور اس سے کیا ہوگا؟
Of course, this is a verified health professional registry where all the healthcare professionals who are applying for verification, their documents, their degrees, they are uploaded, verified through a government system on a 2-tier system, and then they are mapped and then assigned a number. So it will contain only healthcare professionals who are verified, who are genuine, who have the credentials, and all their credentials, their degrees and everything will be uploaded in the system.
اب ہمارے کچھ اسٹیک ہولڈرز جیسے چاہے ڈائگنوسٹک سینٹرز ہے یا کچھ اور ہیلتھ کیئر سسٹم میں کچھ اور بھی ہمارے جو فیسلٹیز ہیں ان کا یہ ماننا ہے کہ دیر از نو سنگل ونڈو سسٹم. تو بہت پروسیس میں بہت پرابلمز ہوتی ہے اینڈ دین دے گیٹ سائڈ لائن, دے جسٹ موو ٹو سم ادر پروفیشن. Do you think Ayushman Bharat is going to create some kind of ecosystem in this?
See, first of all, when you talk about a single window system, I'll take you to the hospital first, to the single window system of the hospital. We had a long waiting queue at the general government hospital for a normal citizen. Ayushman Bharat digital mission under the scan and share QR code system has finished the idea of a queue. There's a QR code of the particular hospital which will, number one, straight away you will scan it and you'll be assigned OPD ticket plus a consultation chamber. And you can even get the consultant's chamber also, the time of consultation. So it will be a great win-win situation for the doctor as well as the patient. The doctor was overburdened, where he could see 50 patients in the OPD, he was seeing 150. So once you assign a particular time for the patient, the doctor will have to see the patient and the next patient will come on that next time. So between that gap, the patient will be examined properly up to his satisfaction. And that will probably be a great win-win situation for the patient, the citizen as well as the doctor.
تو ابھی آپ کو کیونکہ آیوشمان بھارت has already started flying, it has already started opening up the wings and all. تو لوگوں کو اگر آپ کو لوگوں کو بتانا ہوگا کہ آیوشمان بھارت, موٹے الفاظوں میں لوگوں کو یہ بتانا ہوگا کہ آیوشمان بھارت آپ کے لیے کیا کیا جو ہے فیسلٹیز لا رہا ہے, تو ہمارے ناظرین کو بتائیے جو کہ میں بھی انگریزی نہ سمجھ پا رہے ہوں گے, جن کو انگریزی میں بہت دقت آتی ہوگی, تو ان کو آپ بتائیے کہ آیوشمان بھارت آپ کے لیے کیا موٹا کشمیر میں, جموں کشمیر میں لا رہا ہے.
میں تو پہلے یہ کہوں گا کہ آدرنیہ پردھان منتری کی جو یہ ویژن ہے آیوشمان بھارت کی, اس کو ہر ایک سٹیزن کو سیلیوٹ کرنا چاہیے, کیونکہ ایسا جو آئیڈیا ہے انشور کرنے کا ایک سٹیزن کی لائف, وہ ایک کلوسل ایک ڈریم ہے ہماری لیڈرشپ کا. اور اس ڈریم کو جب سٹیزن دیکھے گا, جس کے پاس جب وہ ہاسپٹل جاتا تھا اور چھوٹی سی سرجری کو اس کو 50,000 1 لاکھ, کبھی کارڈیک سرجری میں تو بڑی یا نیورو سرجری میں بہت زیادہ پیسے لگتے ہیں, تو آج کی ڈیٹ میں وہ اپنا آیوشمان کارڈ لے کے, گولڈن کارڈ, ہیلتھ کارڈ لے کے جب ہاسپٹل میں گھستا ہے, اس کو پتا ہے کہ سب فری میں ہونے والا ہے. اور ایسی سکسیس سٹوریز ہمارے پاس آلریڈی بہت ساری ہیں, 2500 سے زیادہ.
But still there is a need for health insurance at a mass scale.
It is for the J&K state, it is for the entire state. Every citizen is insured. He can simply, suppose if I don't have a PMJY card right now, I can walk into the hospital state and say, I'm not well, I want to be admitted, I want to get a card from the hospital counter. His card will be prepared there and then.
اچھا, کچھ پرائیویٹ نرسنگ ہومز, ہاسپٹلس میں ان کو نہیں کہوں گا, there is I think one hospital that has recently come, a private hospital, but باقی تو نرسنگ ہومز کی کیٹیگری میں ہی ہے. there's a lot of disparity as far as the surgery demanding of this fees for surgeries are concerned, consultation is concerned. Why isn't government streamlining this? Why isn't there a proper checklist of all this?
See, first of all, I'll take you to the fact that Ayushman Bharat has paved way for a huge, large, massive private health sector to come in the country. It has opened up vistas for the private sector to come and participate in healthcare. And that is what precisely is happening. Now, there are a lot of people, a lot of multinationals and big names in hospitals which want to come to J&K and, open up hospitals because it is about the PMJY. Because people will come in, have multi-specialty care, and they will be, not charge anything. The government is paying for the health of the people. Now, disparity where you say is because the government sector was always overburdened. Though we have a robust health system in J&K, despite the fact there was, because of the focus was on the peripheral health, the tertiary care health system. The primary health system was always ignored. So the concept of health and wellness centers and taking health to the preventive and promotive part is the aim and objective of the healthcare authorities now. We want to go to the down level and see whether a citizen is healthy at the primary level and the secondary level. He should not be needing to go to the tertiary care at all. So the burden goes down, number one. Number two, then we create avenues for him to shift from government to the private. He doesn't have to necessarily wait for a queue. He will go to the private hospital. You are aware that there are many hospitals which have opened. And first time actually, the big names in hospitals in the country are coming and wanting to open their hospitals in J&K.
One thing which we have witnessed in Kashmir is there's always this dichotomy as far as the tests are concerned. If you go to if you go to a lab, if you go to a diagnostic center, you get a result, and then go for a cross check, you'll get a different result. This is a crime. This is to be taken very seriously as far as the authorities' view on this is concerned. How are you dealing with this kind of nuisance?
Yes, absolutely. This is a matter of concern that laboratories across the country, sometimes patients say that two laboratories gave different tests. So there is this issue of collaboration. There is this National Accreditation Board for hospitals as well as laboratories. We are doing NCOS in hospitals. There are these quality assurance programs. NCOS, National Quality Assurance Systems. We are very particular that this system is, started in all our healthcare system, because calibration of the apparatus, on the test controls and others need to be run from time to time. The machines need to be tested, tried, and tests need to be done on the NABL accreditations, So perhaps this NCOS, this NABL is improving our system. We are already having NCOS hospitals are certified at district levels. We are going through the NABL process on the tertiary care hospitals also. It is a concern, but we are actually aware of this concern, and things are moving at a very fast pace in this matter as well.
So what's your message at the end of the program for the people of Jammu Kashmir?
I feel it percolates all from the national level. Our leadership has been very clear. We are focusing that healthy people is a resource for this country. Health will be the biggest resource. If healthy citizens are, ensured, our success is ensured. So the promotive healthcare, as the Prime Minister, Honorable Prime Minister has, magnified as many times as possible, that we need to promote our healthcare by staying healthy, eating healthy, having healthy manners, meditating and all. That is a very important part of our healthcare system. Number two is to have a system of healthcare where there is accessible healthcare to people, not that they have to wait in queues, not that they have to, go through turbulent times in hospitals. Number one, financially, infrastructure-wise, and the process-wise, the processes, systemic processes, which would be a problem for a patient. I anticipate personally, and the government at the level of the Health Medical Education Department and the leadership of our state, under the dynamic leadership, I would say, of our Honorable Lieutenant Governor, has ensured that healthcare becomes a strong and very, very important priority of the government. And you are already able to see that visibly. I'll tell you just one instance, that the infant mortality rate of J&K fell by 10 digits during 17 and 18 and 19 period. And colossally and globally, it has never been across the globe. 10 points fall means that your healthcare has tremendously improved. That from 33 you have reached to 16 per 16 IMR. So that is a great thing to happen. So the indicators will tell you that J&K health is in the path of progress, and it is a very citizen-centric approach to ensure that affordable, accessible healthcare is available for all the citizens of the state.
Dr. Shabkat, on that note, you said we are on the path of progress, and we are ensuring enabled healthcare ecosystem for the J&K. Thank you so much, and we wish you all the best for that.
Thank you.